it's MK, myself, and we also include Beth as a critical member of this team. We should probably add you to this slide, Beth. I don't know, but Beth has supported us and gotten us back together over the years to make sure this project moved forward. So Carolyn, MK, Beth, and myself, this is something that this group has been working on for the past, I guess it's 3.5 years, something like that now. It's hard to believe that. I think we got a timeline coming up. But basically this group got together to explore the need for competencies for the practice of massage therapy in the hospital environment. Historically, traditionally, massage schools are training massage therapists for environments that don't involve acute patient care, so chiropractic offices, massage franchises, private practice, that sort of thing, with a closed door, dim lights, massage table, that sort of thing. And in recent years, massage therapists have been finding their way back into the hospital environment. I say back into the hospital environment because as we did some research on this, and it's most folks are aware, I think, that massage therapy used to be a huge part of hospital practice. Nurses were trained in massage therapy techniques. There were several references around the turn of the, not this most recent century, but the previous century, articles in American Journal of Nursing from 1907, 1915, that sort of that time period, where there was articles on how to practice massage therapy in this environment, the benefits of it, and indeed the competencies needed to practice in those environments. And they were, of course, reflective of the times, and so they're maybe of little value in terms of the actual detail outlined in the competencies from that time. But anyway, long story short, we wanted to look at the practice of massage therapy in the hospital environment, determine if there was a need for competencies, and then next step would be to develop a process for outlining a standard, centralized set of competencies that could be used by hospitals and schools to prepare students for practice in that environment. Again, because of the huge differences in everything about the environment, from the patient to the type of massage that's being delivered, and so on and so forth. So maybe we can go to that next slide, and it'll show us
Dale,
yeah, go ahead,
if I can
MK.
interject just a little bit
Please.
for there, in that when I started in nursing practice, it was still a part of nursing care in the hospital
That's right.
setting. We've come, and that was in the 70s, everybody. We've come away from that, and really massage therapists are starting to fill the void that has been left with nurses not delivering that service. So it's even
That's
more
right.
imperative, I think, for this work to be done.
That's right. There's we could probably talk for the remainder of the time about the value of massage therapy and the reasons massage therapists are finding their way back into this environment, and it's very exciting to me. I've been at several conferences and chatted with folks that are doing this and the important work that's being done. But so it's exciting, but we'll leave it at that for now. So on the slide that's on the screen now, you can see the history of this particular task force, starting in 2012 when we were formed. We made a presentation at the International Congress for Educators in Complementary Integrative Medicine back in Washington, D.C. That seems like a long time ago, and I guess it is getting to be a long time ago. So, and then in 2013, we developed our survey, which is kind of the bulk of our work, the delivery of that survey and the gathering of data from it to almost 40 hospital-based massage programs, and asking them about their current practices around massage therapy, the need, their opinions about the need for a standardized set of competencies, along with several other questions about, how they practice massage in in their respective environments. And then in 15, our specific competencies were developed based on the survey and going off of the then ACAT competencies, now the collaborative competencies, I guess. And then a follow-up survey was sent out to the original survey takers about the feedback on our competencies, and we've been gathering that. A couple of presentations that we've done this year, and this is on an upcoming slide, I'm sure, but our next step is what we're very excited about is well, I'll say it right now, is a call, there it is, thank you, on September 29th to get many of the survey participants back together, but also anybody that has seen the competencies or has an interest in having input to what the competencies should be. On September 29th, we're having a big conference call with those folks to invite input and have some discussion about the content of the competencies and how they might be used and disseminated. So let's see, I've jumped us out of order on the slides here a bit. Sorry about that. But, okay. So this is our focus, which I've kind of commented on a little bit already. So we think the competencies are needed to prepare practitioners for practice in this environment. A lot of the focus of these competencies is not so much technique based. We think for clinicians, oftentimes the focus of competencies is on technique, and ironically, hospital environment is dealing with some of the most complex clinical problems, but really the focus of the competencies is more on managing the environment, but interacting with the environment. So communication skills, how to talk with a patient in the hospital as opposed to a massage franchise environment, for example. How to work with the physicians, with the doctors and nurses, and managing the environmental elements, and understanding of sounds they may hear in the hospital environment that obviously they need to be prepared for. And some of it is clinical, how to modify a clinical approach from what they might have done on a massage table to a hospital bed. So, and it's also, so that's from the perspective of the practitioner, but also the hospitals themselves. The members of the task force, MK, Carolyn, and myself in particular, have, as probably maybe some of you on the call have fielded calls from hospitals that are interested in moving down that massage therapy route, but they've got all sorts of questions about how do I do this? How where do I find a massage therapist that's appropriately trained? If they're not appropriately trained, where do I send them? What kind of exposure have they had to this environment, and how do I know if they're competent? And indeed, what should the competencies be? Sometimes we assume that maybe those working in a hospital environment should know, what they should be, what they want in a massage therapist, but they don't. This is a new territory for both schools and hospitals. So we're hoping that these competencies can be sort of a level setting from both the schools and the hospitals to meet in that common goal of preparing massage therapists for that environment. So there's our goals, task force goals. We wanted to determine if there was a need for competencies and then develop the competencies for effective practice in hospital environments. So, MK, I'm sort of monopolizing our presentation here, so I should pause and let you jump in with anything you want to add to this point, or maybe you want to Do you want to talk about this piece about our call agenda on the 29th?
Sure, I'd be happy to. So as Dale has mentioned, we have invited those who participated in this survey as well as those who have contacted us over the years. As you saw, we've had a relatively long time together. And people have heard about it and have expressed interest in it. And we've also recently received some feedback as well on the competencies. There was some feedback after the article in the Massage magazine for us. So a number of people have been invited. I don't know what our total right now is, Beth, who have responded that they will be joining us. But if anyone on this call is interested, please feel free to join us on the 29th. We will be reviewing the competencies. It will not be an opportunity for folks to be telling us what to put in it necessarily. We are going to be going through the competencies and fielding input on those, and then inviting folks to write us and let us know, what they would think should be in there. We've received recently somebody writing, stating that there should not be contraindications included in one of the competencies that we have, based on their experience. So it'll be an interesting discussion, I think. We're not looking for a lot of wordsmithing on this call, but really some ideas, some input, and then people can add their words later. The goal is to have anyone submitting any ideas for wording by a certain date. I think we were looking at perhaps the end of October, because we'd like to finalize the competencies by the beginning of December. We're also going to be discussing, as it says here, strategies for dissemination. What are we going to do with these? How are we going to get these out to folks? What are the appropriate audiences for that? And finally, I think would be of interest for this call, one of the things we went into this project with an idea of was how could others use what we've done for their own fields, for their own professions. Would it be beneficial? And so for that, we would be a resource as well if others are interested in pursuing something.
Fantastic.
Beth, did you have, because you've been with us all along, Beth, and you are a part of the group as Dale said.
Yeah,
so.
thank you. I definitely, yep, I've been to pretty much all the presentations and I do feel that. I just want to, again, go back to the timeline and point out that this was a really nice interview with MK. The print issue and the online link are different. So it'd be nice to have the print article too, but here is a link that I can send out after the call if you're interested. It's a very nice article describing the project, and as MK and Dale mentioned, the collaborative is multidisciplinary. One of the reasons we took on this project that had to do with a single discipline was with the intent that it could be used with the other disciplines as well. So we're getting ready to be at that stage and working with Liza and possibly the consortium as well might be a future activity. So I think I'd like to pause here. Wonderful job, Dale and MK. Sorry that Carolyn wasn't able to make this particular call, and find out if there's any questions or thoughts or interest from people on the call.
This is Mike Wiles. Oh, sorry. I was just going to ask Dale if there's. I'm looking at the timeline. I think it's a great progress, and this, believe it or not, is very, very applicable to all of our health disciplines, and even the chiropractic profession, which would like to think that it's pretty sophisticated and advanced. It is nowhere near this. We could basically follow in your footsteps and do exactly the same stuff for the chiropractic profession, frankly. But I was wondering about outcomes of this and objective outcomes. Have you got some kind of a national registry or list of hospitals that have incorporated massage therapy? And is this number going up? The fruits of this work.
Yeah, great question. There has been some work done previous to our group coming together to create a registry of hospitals that are offering massage therapy. I think it's that work has sort of fallen off a little bit and has not been kept up. So I'm not sure if there's an updated list. Our survey was basically a convenience sample of who knows somebody that's practicing massage in the hospital, and just kind of asking around. And at that Washington conference, we invited people to participate and let us know if you're doing it. But as far as I know, I don't know. I'm not aware of a great list. As far as whether it's going up or not, the American Hospital Association does have some data that indicates that the use of all CAM therapies in the hospital environment is increasing pretty significantly, with massage leading the way. The only one that's outpacing massage therapy as far as popularity in the acute care setting is pet therapy. That one's tough to compete with those cute little puppy dogs, I guess. But yeah, it is on the rise.
I would also add that our task force members are very active in other massage therapy groups, so we've done quite a lot to make sure that we're not overlapping with other groups who are doing the same kind of work, and we've been able to leverage with other groups in some situations of having membership overlap. So that's a strength also that will help in the dissemination.
Yeah.
I want to reply to a message that came up in the chat about providing information for the September 29th call. If anybody is interested in either being on the call or passing it along, please send me an email, let me know, and then I will send you the invitation to the call, and that way we can keep track of who's interested in being on the call that way.
And just so everyone knows, those who are invited to the call also get a copy of the draft competencies.
So this is Liza, and there are a few other things going on, and one of the things I think, if it's okay, I'd like to work on, with Dale, MK, and Carolyn, and Beth, is that I just received information from Arya Nielsen that for some reason it's a consortium policy working group, and then they work a little bit with NCCOM on a similar type of project, but much more reduced. They just did a template for the issue of credentialing and privileging for acupuncturists, and as you know, the previous executive director, John Weeks, was working on that area as well. And it just seems as though now, and I'm going to talk to her over the weekend because she said their next area they're interested in is massage therapy, and she said she had heard we were working on this, so I will talk to her over the weekend. But I think a strategy here, if you all are okay with it, is for Dale, MK, and Carolyn, is to put you all in direct communication with the consortium. And I know also at the executive committee level, we're talking to be sure, one, we don't duplicate what each other is doing, but also the more we can work in collaboration, that could be very helpful. And it seems to me that this would be the primary subcommittee to work with them potentially, if you want to, on a partnership for kind of a template. But we can talk about this a little more offline, and I just heard about it. And so I was a little surprised about that. So the kind of the communication and the coordination with our conventional medicine colleagues, I think, could be very helpful and very important in this area. This is great work you've done. And I do think it will sets an excellent foundation, like Mike was saying, for our other disciplines.
Thank you, Liza.
And for the national course, and for the national course we're about to develop with a consortium, which will include individuals that have worked on these kinds of projects.
Yeah, I'd be happy to talk with anyone
Great.
that
Good.
expanses this. One
sure.
last thing that I wanted to mention, Dale, if I could, is that we have also submitted a journal article to the Journal for Body Work and Movement Therapy, Leon Chetow's journal. So we're waiting to hear back from Leon about that.
And we're hoping to have a poster presentation at the Academy conference at the end of October as well.
Yeah, I was just going to ask you about that.
San Diego. Yeah.
Great.
Any other?
I think my last comment is it's so much better if within our disciplines we begin to kind of, we take the initiative of creating the competencies, you know, that we see will really be very, very helpful to our disciplines of work in such environments, and then also receive the feedback from those environments. Yeah, this is great.
Good job, task force.